With the old technique, incorrect, and by the way, the razor, I took one apart, cut the entire length that depth, and that's the little razor. It comes bigger yet. So the size of the razor isn't the problem. It's the way you're doing it, so make sure you're pointing down. But with pediatrics, with sick babies, when they run out of heel to mutilate or to cut and it's mutilated, they will start on the toes. And I've had numerous mothers sit in these classes, and all of a sudden the light bulb comes on. But the one said, "Is that why my child cuts the toes out of every pair of socks?" The little girl was actually 4. They went to the store to buy something. The mom bought her some socks, set them on the kitchen countertop when they got home. The little girl picked them up, took them to her play table, picked up her pretend scissors, and tried to cut the toes off. And that was the first time in the little girl's 4-year-old life that the mother knew there was something wrong, because the little girl said, "It hurts." And this was a little girl whose toes were mutilated from sticks. So if the nerve endings don't heal end to end, because the nerve endings have been crushed and they don't heal end to end, they heal off, they end up with a permanent paresthesia. And depending on the degree, it can be a mild burning, it can be chronic pain, it can be painful just when it's touched. But the point is, it's abnormal, and they have to live with that the rest of their days. With infant heel sticks, gravity is an issue as well. And so typically what they do is they put baby on its back, they put the foot up in the air, and they pinch the foot back to the shin. Well, first of all, that Achilles tendon wasn't designed to be stretched that far, not on any human, not even a newborn, because you can tear the tendon from the bone, and it's painful. But also when you stretch the skin really tight, it's white. No blood is traveling through there. And then that's why they're having to squeeze, squeeze, squeeze to get every smudge of blood out of there that they can. So not only did they injure the Achilles tendon, but now they've caused a crush injury and a bruise, and they've hemolyzed the sample of blood that is an insufficient quantity usually. So we're going to change all that. We're going to hold the infant. The part that you want to bleed must face the floor, because if you lift up, gravity will take blood to the baby's butt, not to its heel. We prep the site, and you must stick one side or the other, not the tendon. Tendons are white, it won't bleed, it will be painful. So we prep the site. Notice that I've supported every tendon. I haven't stretched anything. Then you come in with a cutter. Place it going the same grain as the direction of the same grain as the skin. We click, and literally drips of blood will start to form. Typically they're going to collect in these little devices, and there's a certain quantity that needs to be in there. So you hold this to behind the point where you put the cut, to the skin. And blood will run down the inside back. You'll see it raising on the front, so you know exactly how much is in there. And if you have to encourage bleeding at all, squeeze the ankle, not the site. And you will avoid a crush injury, you'll avoid hemolysis, you'll avoid the tendon injury, and you'll have a quantity sufficient sample of blood. And remember, it takes 3 minutes for a clot to form, so somebody must apply gentle pressure till that has clotted. This sample needs also to be gently mixed, the appropriate number of times for the color of the tube, and then sent down to the lab. They'll centrifuge it, discover that it's not hemolyzed, and it's a quantity sufficient sample. Lab is happy, baby is happy, nurse is happy, and the mom is happy.